Now at 4, your community focus. We're talking COVID-19 today with Dr. Jim McDonald from the Rhode Island Department of Health.
He joins us every week on 12 News Now at 4. Dr. M, thanks so much for being with us again.
Oh, Kim and Brian, good to see you again. Happy Wednesday.
Happy Wednesday. Dr. M, we're all highly anticipating tomorrow when the state is expected to release guidance for phase 2 of vaccinations. And we've heard from the Lieutenant Governor that he's pushing to prioritize teachers. So I want to know, if that happens, can we expect to see other groups like bus drivers and grocery store workers prioritized as well?
Yeah, that's where it gets complicated, doesn't it? Like, you start making conversation about hospitality industry, truck drivers. It gets complicated. And I think, one of the things I keep in mind is we all want the same thing, right? We want to get vaccine out to people at highest risk. So, because we're really trying to prevent people from passing away from this disease and people being in a hospital. I think strategies that really focus on reducing hospitalization, reducing death, that's going to get us quicker to where we all want to get to, which is an opened up economy and back to normal. So I think that's what we're looking for. Let's see. We'll see what happens.
And Dr. Emma, I just want to ask a follow-up on that. Do you think vaccinating folks like teachers, bus drivers, you mentioned some other industries, do you think that would be the best path towards reducing hospitalizations and deaths?
I think if you did it by age, like 65 and older, for any occupation, it would make a lot of sense, because then you're getting the high-risk group. And that's the way I think about it, Kim, is I think about who is highest risk. And I think that makes the most sense.
On the vaccine front, we are hearing that states could start to see more doses arriving next week. Do you know, is Rhode Island going to get more doses? And any idea of a number that we'd be getting that would boost from what we have?
Yeah, it's interesting. We're getting more Moderna vaccine next week, so we're getting 14,000 doses a week, and starting next week, we're getting 17,000 doses a week. What's interesting, though, is President Biden kind of teased more, and we haven't heard anything on that. So we're always have our ears open to see maybe there's even more coming. But, we kind of found out, it's a little bit like Christmas morning every week for us. We're like, oh, here's what's coming. It's a bit of a surprise. But we do know we're getting more next week, another 3,000 doses. So that's a plus. Hopefully there'll be more coming soon.
And Dr. M, when I spoke with you back in early December, you estimated that life might start to look a little bit more normal again around Mother's Day or Memorial Day. But I wanted to check back in because knowing what we now know about vaccine distribution, is that still your best estimate, Memorial Day or Mother's Day?
Yeah, I'm not so sure, Kim. It might be more closer to summertime. I will say this. The McDonald family hasn't been on vacation in a long time, and I mean long time. The pandemic's kind of done that. So we're going away at the end of May. So you can take that and say, well, that's something, right? So end of May, we're going to go away. So I think things like that are going to be more easier to do. But I think when you look at fully being back to normal, like everyone getting a vaccine who wants to, I think we're looking more at 4th of July. And this is just based on what I'm seeing with the vaccine rollout being a little bit slower than what I hoped it would be. And hopefully that's going to pick up. We'll have to wait and see. I'm kind of excited about next week, by the by, because if Johnson & Johnson has something exciting to tell us at this time next week, that might be a little bit more optimism for all of us. And we're hearing some information through the grapevine that they have something to tell. So we'll see. We'll see what next week brings.
So again, your estimate now, the 4th of July?
Yeah, I guess so. Sorry about that. I want it to be over sooner, guys. I really do. But it's like, oh, I don't know. Maybe we have to wait and see. Hopefully we'll see something come out next week that makes it come a little bit shorter. But we have to wait and see right now.
I want to also ask you about the monoclonal antibody treatment. We've heard about the success of that. That's the Regeneron cocktail that former President Donald Trump received when he had the coronavirus. It's been shown to decrease hospitalizations. And we checked in with the Department of Health. Only about 1/3 of the doses that we have available to us have been administered so far. So, Dr. M, why hasn't more of this been doled out?
So we're actually one of the few states that has a bunch of it. So think of it this way, Kim. We've given over 1,500 doses, and I'm excited about that. We actually have more, so we're in a much better position than other states, and we have plenty. So if you're eligible, 65 or older, and you're not in the hospital, you're eligible. And for some people younger who have comorbid conditions, you're eligible too. Talk to your doctor about it, because we can cure you with this quicker. I mean, and this is one of those things where I think one of the things that's holding it back is people don't know this became a treatable and curable disease. And quite frankly, they're just going to a testing site, getting the result, and going home. And it's like, well, wait a minute, folks. Let's see about treatment. And that's where you need to talk to your doctor and get signed up for that.
All right, Dr. Jim McDonald from the Rhode Island Department of Health, thank you as always for joining us.
Thank you, guys. Have fun.